I'm Travis. This is my wife Carolyn and our son Ethan and our daughter Leah. We're the Souter family. Leah was diagnosed with maple syrup urine disease in 2010 when she was 4 days old.
We received a call from a nurse from the Clinic for Special Children saying that her newborn screening test came back abnormal and that she tested positive for maple syrup urine disease. We kept saying to each other, they have the wrong family, this isn't us, this doesn't happen to us. It just felt like our world fell apart. We didn't know what to do. We didn't know what was going to be required of us in taking care of her. We didn't know what was going to happen to her. It's a very scary time.
Maple syrup disease is a metabolic disorder where missing enzymes that are made in the body do not allow the proper handling of proteins. It could potentially have very significant side effects, particularly neurologic and brain-related side effects such as stroke or other types of neurodevelopmental problems.
You know, those dreams that you have of having teacup parties and daddy-daughter date nights, and when you're initially told that this could cause brain damage or death, all those things kind of seem to go out the window. One option, a route that we had to consider was if we wanted to do a liver transplant for Leah, and Children's Hospital has done more transplants for maple syrup urine disease than anyone else, and they understand maple syrup urine disease better than any other hospital.
We met Leah relatively early in her medical journey. She met the criteria for consideration of transplant based on very near total absence of the appropriate enzymes that are functioning or not functioning in maple syrup disease. After going through the different experience that we've had with maple syrup disease and the potential benefits and risk of all the different therapies, the family was in agreement to proceed with liver transplant for her.
The liver transplant does not take away the maple syrup urine disease, it just kind of controls it. You can live a perfectly healthy, normal life with MSUD, but there's always that fear involved of getting sick. That's the major concern and the major reason why we chose the route of a liver transplant.
We've been very encouraged by Leah's progress. She was transplanted about a year ago, and she has done very well.
The Clinic for Special Children was able to give us the referral to Children's, and Children's was just amazing to work with. They explain every procedure very well to us. I never felt like I was left in the dark as far as what was happening with Leah's care.
We can't say enough about the surgeons and the nurses and everybody. They were just great, made you feel very comfortable, and were very caring and concerned for Leah.
Leah is really able to now enjoy the typical life of a 3-year-old.
Leah is just amazing to watch.
She is vibrant and full of energy and loves to dance and sing.
She's able to eat and participate in all activities, and she's able to do so without a fear or her parents' fear of having an unexpected neurologic or metabolic problem because of her MSUD.
I hope that Leah can just be an inspiration to others. She just is pulled through this whole situation amazingly, better than I could have. We just really want her to have an amazing story that she can tell.
Our teams of international experts are focused on treating children with rare diseases, defined by leading standards of care, pioneering protocols, and individualized services in a world-class environment. At Children's Hospital of Pittsburgh of UPMC, you are not alone.